Prostate gland enlargement is a common condition as men get older, also called benign prostatic hyperplasia (BPH). Prostate gland enlargement can cause bothersome urinary symptoms. Untreated prostate gland enlargement can block the flow of urine out of the bladder and cause bladder, urinary tract, or kidney problems. There are several effective treatments for prostate gland enlargement, including medications, minimal invasive therapies, and surgeries. To choose the best option, you and your doctor will consider your symptoms, the size of your prostates, other health conditions you might have, and your preferences. Symptoms. The severity of the symptoms in people who have prostate gland enlargement varies, but symptoms tends to gradually worsen over time. Common signs and symptoms of BPH include frequent or urgent need to urinate, increased frequency of urination at night, nocturia, difficulty starting urination, weak urinary streams or stream that stops and starts, dribbling at the end of urination, straining while urinating, inability to complete empty the bladder. Less common signs and symptoms include urinary tract infection, inability to urinate, blood in the urine. The size of your prostate does not necessarily mean your symptoms will be the worst. Some men with only slightly enlarged prostates can have significant symptoms, while other men with very enlarged prostates can have only minor urinary symptoms. In some men, symptoms eventually stabilize and might even improve over time. Other possible causes of urinary symptoms, conditions that can lead to symptoms similar to those caused by enlarged prostate include urinary tract infection, inflammation of the prostate, prostatitis, narrowing of the urethral stricture, scarring in the bladder neck as a result of previous surgery, bladder or kidney stones, symptoms with nerves that control the bladder, cancer of the prostate or bladder. Causes. The prostate gland is located beneath your bladder. The tube that transports urine from the bladder out of your penis urethra passes through the center of the prostate. When the prostate enlarges, it begins to block urine flow. Most men have continued prostate growth throughout the life. In many men, this continued growth enlarges the prostate enough to cause urinary symptoms or to significantly block urine flow. It is not entirely clear what causes the prostate to enlarge. However, it might be due to changes in the balance of sex hormone as men grow older. Risk factors. Risk factors for prostate gland enlargements include aging. Prostate gland enlargement rarely cause signs and symptoms in men younger than age 40. About one-third of the men experience moderate to severe symptoms by the age of 60 and about half do so by age of 80. Family history. Having a blood relative such as father or brother with prostate problems means you have more likely to have problems. Ethnic background. Prostate enlargement is less common in Asian men than in white and black men. Black men might experience symptoms at a younger age than a white man. Diabetes and the heart disease. Studies show that diabetes as well as heart disease and use of beta blockers might increase the risk of BPH. Lifestyles. Obesity eases the risk of BPH while exercise can lower your risk. Complications of enlarged prostate can include sudden inability to urinate, urinary retention. You might need to have a tube catheter inserted into your bladder to drain the urine. Some men with an enlarged prostate need surgery to relieve urinary retention. Urinary tract infection (UTIs), inability to fully empty the bladder can increase the risk of infection in your urinary tract. If UTI occurs frequently, you might need surgery to remove part of your prostate. Bladder stones. These are generally caused by an inability to completely empty the bladder. Bladder stone can cause infection, bladder irritation, blood in the urine, and the obstruction of the urinary flow. Bladder damage. A bladder that has not emptied complete can stretch and weaken over time. As a result, the muscular wall of the bladder no longer contracts properly, making it harder to fully empty your bladder. Kidney damage. Pressure in the bladder from the urinary retention can directly damage the kidneys or allow bladder infection to reach the kidneys. Most men with an enlarged prostate do not develop these complications. However, acute urinary retention and the kidney damage can be a serious health threats. Having an enlarged prostate does not affect your risk of developing prostate cancer. Test and diagnosis. Your doctor will start by asking detailed questions about your symptoms and doing a physical exam. This initial exam is likely to include digital rectal exam. The doctor inserts a finger into your rectum to check your prostate for enlargement. Urine test. Analyzing a sample of your urine can help rule out an infection or other condition that can cause similar symptoms. Blood test. The results can indicate kidney problem. Prostate specific antigen PSA blood test. PSA is a substance produced in your prostate. PSA level increases when you have an enlarged prostate. However, elevated PSA levels can also be due to recent procedure, infection, surgery, or prostate cancers. Neurological exam. This brief evaluation of your mental functioning and nervous system can help identify causes of urinary problems other than enlarged prostate. After that, your doctor might recommend additional tests to help confirm an enlarged prostate and rule out other conditions. These additional tests might include urinary flow test. You urinate into a receptacle attached to a machine that measures the strength and amount of your urine flow. These results help determine over time if your condition is getting better or worse. Post-void residual volume test. This test measures whether you can empty your bladder completely. This test can be done using ultrasound or by inserting a catheter in your bladder after you urinate to measure how much urine is left in your bladder. 24-hour voiding diary. Recording the frequency and the amount of urine might be especially helpful if more than 1/3 of your daily urinary output occurs at night. If your condition is more complex, your doctor may recommend transrectal ultrasound. An ultrasound probe is inserted into your rectum to measure and evaluate your prostate. Prostate biopsy. Transrectal ultrasound guides needle used to take tissue sample biopsies of the prostate. Examining the tissue can help your doctor diagnose or rule out prostate cancer. Urodynamic and pressure flow studies. A catheter is threaded through your urethra into your bladder. Water, or less commonly air, is slowly injected into your bladder. Your doctor can then measure bladder pressures and determine how well your bladder muscles are working. Cystoscopy. A light flexible cystoscope is inserted into your urethra, allowing your doctor to see inside your urethra and bladder. You will be given a local anesthesia before the test. Intravenous pyelogram or CT urogram. A tracer is injected into a vein. X-ray or CT scans are then taken of your kidneys, bladder, and the tubes that connect your kidneys to your bladder. These tests can help detect urinary tract stones, tumors, or blockage above the bladder. Treatments and drugs. A wide variety of treatments are available for enlarged prostates, including medication, minimally invasive therapies, and surgery. The best treatment choice for you depends on several factors, including the size of your prostate, your age, your overall health, and the amount of discomfort or bother you are experiencing. Medications. Medication is the most common treatment for mild to moderate symptoms of prostate enlargement. The options include alpha blockers. These medications relax bladder neck muscles and muscle fibers in the prostates, making urination easier. Alpha blockers, which include alfuzosin, doxazosine, tamsulosin, and silodosin, usually work quickly in men with relatively small prostate. 5-alpha reductase inhibitor. These medications shrink your prostate by preventing hormonal changes that cause prostate growth. These medications include finasteride, Proscar, and dutasteride Avodart. Might take up to 6 months to effective. Combination drug therapy. Your doctor might recommend taking an alpha blocker and a 5-alpha reductase inhibitor at the same time if either medication alone is not effective. Tadalafil study suggests these medications, which is often used to treat erectile dysfunctions, can also treat prostate enlargement. However, this medication is not routinely used for BPH and it is generally prescribed only to men who experiences erectile dysfunction. Minimal invasive or surgical therapies. Minimal invasive or surgical therapy might be recommended if your symptoms are moderate to severe. Medication has not relieved your symptoms. You have a urinary tract obstruction, bladder stones, blood in your urine, or kidney problems. You prefer definitive treatment. Minimal invasive or surgical therapy might not be an option if you have an untreated urinary tract infection, urethral stricture disease, a history of prostate, radiation therapy, or urinary tract surgery, a neurological disorders such as Parkinson's disease or multiple sclerosis. There are several types of minimal invasive or surgical therapy: transurethral resection of the prostate, transurethral incision of the prostate, transurethral microwave thermotherapy, transurethral needle ablation, laser therapy, prostate lift, immobilization, open or remote assisted prostatectomy, lifestyles and home remedies. To help control the symptoms of an enlarged prostate, try limit beverages in the evening. Do not drink anything for an hour or two before bedtime to avoid middle of the night trips to the toilet. Limit caffeine and alcohol. They can increase urine production, irritate the bladder, and worsen symptoms. Limit decongestants or antihistamines. These drugs lighten the band of muscles around the urethra that control urine flow, making it harder to urinate. Go when you first feel the urge. Waiting too long might overstretch the bladder muscles and cause damage. Schedule bathroom visits. Try to urinate at regular times, such as every 4 to 6 hours during the day, to retrain the bladder. This can be especially useful if you have severe frequency and urgency. Follow a healthy diet. Obesity is associated with enlarged prostate. Stay active. Inactivity contributes to urine retention. Even a small amount of exercise can help to reduce urinary problems caused by an enlarged prostate. Urinate and then urinate again a few moments later. This practice is known as double voiding. Keep warm. Colder temperatures can cause urine retention and increase the urgency to urinate.